Welcome back to the channel. If you are new here, we focus on practical, honest health information specifically for adults over 60, the kind of straight talk your body deserves at this stage of life. Now, today's topic might unsettle you a little, and frankly, it should, because what we are about to discuss is something almost nobody talks about with their doctor: sleep position. Specifically, one extremely common sleeping position that research has linked to increased stroke risk, particularly in older adults whose arteries have already begun to stiffen and narrow with age. We are not talking about rare medical anomalies here. We are talking about a habit millions of people repeat every single night without a second thought. And the scary part is that the warning signs, if there even are any, tend to show up as symptoms people dismiss. A little morning dizziness, some neck stiffness, a headache that fades after coffee. By the end of this video, you will understand exactly which position puts your brain at risk, why it becomes more dangerous after 60, what the research actually says, and how to adjust your sleep tonight comfortably so that you wake up safer tomorrow morning. Let's get into it. Before we name the position, you need to understand a small but critical piece of anatomy. Running along each side of your neck, tucked behind muscle and threaded through the bones of your cervical spine, are your vertebral arteries. These two vessels carry roughly 30% of the total blood supply to your brain. They feed the brainstem, the cerebellum, and portions of the occipital lobe, regions responsible for balance, coordination, vision, and basic life-sustaining functions like breathing and heart rhythm. Now here is the part that matters for tonight. Unlike the larger carotid arteries in the front of your neck, vertebral arteries are comparatively delicate. They wind through small bony canals in your cervical vertebrae, almost like a garden hose threaded through a series of rings. In a younger person with flexible, elastic artery walls, moderate head turning and neck bending pose very little threat. The vessels flex and accommodate, but after 60, the situation changes. Artery walls lose elasticity. Atherosclerotic plaque, that chalky buildup of cholesterol and calcium, begins narrowing the interior passage. The bony canals themselves may develop small osteophyte spurs from decades of cervical wear. Suddenly, those vertebral arteries have far less room to maneuver. And any sustained pressure, any prolonged twist or compression can reduce blood flow to dangerously low levels or, in worst cases, damage the inner lining of the artery wall itself, creating a tear called a dissection where blood clots can form and travel directly into the brain. This is the mechanism. This is the silent danger hiding inside your pillow. So which position are we talking about? Sleeping on your stomach with your head turned sharply to one side, that is the position. And if you just felt a jolt of recognition, if you pictured yourself face down on the mattress, neck cranked 90 degrees to the left or right so you can breathe, you are not alone. Stomach sleeping with full cervical rotation is one of the most common sleep habits in the world. Some estimates suggest nearly 16% of adults prefer this position, and many others drift into it unconsciously during the night, even if they fall asleep on their back or side. Here is why it becomes a serious problem after 60. When you lie prone and rotate your head fully to one side, the vertebral artery on the opposite side gets compressed against the bony transverse process of the atlas vertebra, that is the very top bone of your spine, right where your skull meets your neck. In a young, healthy artery, the compression is temporary and mild. Blood reroutes through the opposite vertebral artery or through collateral channels, and no harm occurs. But in an older adult with any degree of arterial stiffness, cervical spondylosis, which is present in over 85% of people past age 60, or existing plaque narrowing, that compression becomes significant. Sustained over 6, 7, 8 hours of sleep, it can reduce posterior cerebral perfusion enough to starve tissue of oxygen, or it can create turbulent flow conditions along the artery wall that promote clot formation. A 2022 review published in the Journal of Clinical Neuroscience examined cases of vertebral artery dissection and noted that prolonged neck rotation, especially during sleep, was identified as a precipitating factor in a meaningful subset of posterior circulation strokes in patients over 55. Another study from Stroke Research and Treatment highlighted that positional vertebral artery compression during sustained head rotation was measurable on duplex ultrasound, meaning researchers could actually watch blood flow decrease in real time when subjects turned their heads and held the position. This is not speculation. The blood flow reduction is measurable, the stroke cases are documented, and the population most vulnerable is adults over 60 who already carry the burden of age-related vascular changes. If that does not make you want to rethink how you lie down tonight, I am not sure what will. Now, here is where it gets personal. Many seniors ignore subtle symptoms that may actually be connected to compromised blood flow during sleep. Let me walk through a few, and I want you to be honest with yourself about whether any of these sound familiar. First, morning dizziness or vertigo that fades within an hour of waking. You sit up on the edge of the bed, and the room tilts for a moment. Maybe you grab the nightstand. You assume it is just getting up too fast, or maybe an inner ear issue, and sometimes it is. But recurring morning vertigo, specifically upon waking, can indicate that posterior cerebral circulation was compromised during the night. Your brainstem and cerebellum, the balance centers, were running on reduced fuel for hours. Second, a dull headache at the base of your skull when you wake up, not a tension headache across your forehead. A deep, heavy ache right where your skull meets your neck, sometimes extending down into one shoulder. This can signal muscular strain from sustained rotation, but it can also indicate vascular irritation along the vertebral artery pathway. Third, brief visual disturbances in the first minutes after waking. A moment of blurred vision, a fleeting dark spot, a strange shimmer at the edge of your visual field. The occipital lobe, your brain's visual processing center, receives its blood supply from the posterior circulation fed by those vertebral arteries. Transient visual symptoms upon waking deserve attention, not dismissal. Fourth, neck stiffness that seems worse in the morning than at any other time of day, particularly on one side. While general cervical stiffness is common with age, asymmetric morning stiffness after stomach sleeping may indicate that your neck spent hours in a position that compressed both soft tissue and vascular structures. None of these symptoms alone confirms a stroke risk, but if you are a stomach sleeper over 60 and you experience any combination of these regularly, your body may be sending you a message you have been translating wrong for years. If you are over 60, or if you are caring for an elderly parent, spouse, or loved one, this information genuinely could be life-saving. Stroke is the fifth leading cause of death in the United States and a leading cause of long-term disability. And the posterior circulation strokes we are discussing today, the ones connected to vertebral artery compromise, are among the most frequently misdiagnosed because their symptoms mimic dizziness, inner ear problems, and simple aging. So do me a favor. If anything in this video has made you pause and think, tap that subscribe button so you do not miss future videos like this one. And consider sharing this with someone you love. Sometimes the people closest to us need to hear this from a screen before they will hear it from us across the dinner table. Let us dig a little deeper into why age amplifies this risk so dramatically, because understanding the why helps the advice stick. After 60, several physiological changes converge to make prolonged neck rotation during sleep increasingly hazardous. Arterial compliance decreases. The walls of your blood vessels become stiffer, less able to absorb and accommodate external pressure. Think of it as the difference between stepping on a new rubber garden hose versus an old sun-baked one. The old hose kinks, the old hose cracks. Your vertebral arteries at 70 do not respond to compression the same way they did at 35. Cervical degeneration progresses, disc height loss, facet joint hypertrophy, uncovertebral osteophytes. These age-related spinal changes physically narrow the bony canals through which the vertebral arteries travel. Less space means less tolerance for any additional compression from head rotation. Collateral circulation weakens. Younger brains have a robust network of backup blood supply routes, particularly through the circle of Willis at the base of the brain. In many older adults, portions of the circle of Willis are incomplete or narrowed by plaque. The safety net has holes in it. When one vertebral artery gets compressed during stomach sleeping, the brain cannot reroute blood as efficiently as it once could. Blood viscosity and clotting tendency increase. Older blood tends to be slightly thicker, slightly more prone to forming clots, especially in areas of turbulent or sluggish flow, exactly the conditions created when an artery gets partially compressed for hours overnight. And finally, hypertension, high blood pressure, affects roughly 70% of adults over 65 in the United States. Chronic hypertension damages the endothelial lining of arteries, making them more vulnerable to dissection tears when subjected to mechanical stress like sustained rotation. Each of these factors alone raises risk modestly, but stacked together, night after night, year after year, in someone who sleeps face down with their neck cranked to one side, the cumulative effect is a quietly ticking clock. All right, enough about the danger. Let us talk about solutions, because knowing the problem only matters if you do something about it tonight. Changing a lifelong sleep habit sounds daunting, but it is far more achievable than most people expect. Your body adapts faster than your mind assumes it will. Here are specific, practical strategies that work. Switch to side sleeping, specifically your left side when possible. Side sleeping keeps your cervical spine in a relatively neutral alignment. No extreme rotation, no sustained vertebral artery compression. Left side sleeping carries an additional cardiovascular benefit. It promotes venous return and may reduce nighttime blood pressure slightly by keeping the inferior vena cava uncompressed. Place a firm pillow between your knees to keep your hips aligned, and use a pillow thick enough that your head stays level with your spine, not tilted up or drooping down. If you must sleep on your back, elevate your head slightly. A gentle incline of about 15 to 20 degrees, achievable with a wedge pillow or an adjustable bed base, helps maintain cerebral blood flow and reduces the risk of positional apnea, another overnight stroke risk factor. Keep a small rolled towel or cervical pillow under the curve of your neck for support, and avoid stacking multiple flat pillows that push your chin toward your chest, because that posture can compress the front cervical vessels instead. Use physical barriers to prevent rolling onto your stomach during the night. This is a trick physical therapists have recommended for decades. Sew a tennis ball into a pocket on the front of an old sleep shirt. The discomfort when you roll face down will nudge you back to your side without fully waking you. Alternatively, place a firm body pillow along your front side. It acts as a gentle barricade that your sleeping body learns to stop fighting within a week or two. Address the comfort issue directly. Most stomach sleepers choose that position because it alleviates lower back pain or creates a feeling of security and pressure across the chest. If lower back pain is the driver, a pillow under your knees while lying on your back or between your knees on your side often provides the same relief. If the chest pressure sensation is what you crave, a weighted blanket in the 8 to 15 pound range can replicate that feeling without requiring you to lie prone. Give yourself a 2-week commitment window. Sleep researchers have found that most adults can adapt to a new primary sleep position within 10 to 14 nights. The first 3 nights feel strange. By night 7, your body begins defaulting to the new position. By night 14, the old habit feels foreign. 2 weeks of mild discomfort to protect your brain for the rest of your life. That is an exchange worth making. While we are on the subject of protecting your brain overnight, let me give you a few additional strategies that complement safe sleep positioning. Stay hydrated before bed, but strategically. Dehydration thickens blood and promotes clotting, especially during the long overnight fast when you are not drinking anything. A small glass of water, 4 to 6 ounces, about 30 minutes before bed, helps maintain blood viscosity without causing excessive nighttime bathroom trips. If frequent urination is already a problem, talk to your doctor about timing your fluid intake earlier in the evening. Keep your bedroom cool. Research consistently shows that sleeping in a room between 65 and 68 degrees Fahrenheit promotes better cardiovascular stability overnight. Heat increases heart rate and can elevate blood pressure during sleep, both of which compound stroke risk. Manage sleep apnea aggressively. Obstructive sleep apnea causes repeated oxygen drops throughout the night, each one a small insult to your blood vessels and brain tissue. If you snore heavily, wake up gasping, or feel unrested despite a full night of sleep, pursue a sleep study. CPAP therapy, while not glamorous, reduces stroke risk in apnea patients by a significant margin. Your partner might notice the snoring before you do. Listen to them. Take prescribed blood pressure medications at the time your doctor recommends. Some newer research suggests that taking certain antihypertensives at bedtime rather than morning may provide better overnight blood pressure control. But this decision belongs to your physician, not to a YouTube video. Bring it up at your next appointment, ask the question, and finally, know the signs of stroke and act on them without hesitation. Facial drooping, arm weakness, speech difficulty, sudden severe headache, sudden vision loss, sudden loss of balance. If any of these occur upon waking or at any other time, call emergency services immediately. Time lost is brain lost. Every minute matters. Let us bring this home. Tonight, when you pull back the covers and settle in for sleep, you now know something that most people walking around in the world do not. You know that sleeping on your stomach with your head cranked to one side places sustained mechanical stress on your vertebral arteries, the vessels responsible for feeding the back of your brain. You know that after 60, age-related changes in your arteries, your cervical spine, your collateral circulation, and your blood itself make that stress far more consequential than it was decades ago. You know the subtle warning signs: morning dizziness, occipital headaches, transient visual changes, asymmetric neck stiffness, that your body may have been whispering to you for months or years. And most importantly, you know exactly what to do about it. Side sleeping with proper pillow support, back sleeping with gentle elevation, physical barriers to prevent unconscious rolling, a 2-week commitment to retraining a habit that no longer serves you. This is not about fear. This is about taking one quiet, powerful action tonight that protects the organ you need most. Your brain holds every memory of every person you have ever loved. It holds your voice, your balance, your independence. It deserves to be protected while you sleep, not endangered by a habit you never questioned. You have questioned it now. That puts you ahead of almost everyone your age. Use that advantage. If this video gave you something valuable today, hit that subscribe button and tap the bell so you never miss our weekly senior health videos. Every single one is designed to give you information your doctor may not have time to explain in a 15-minute appointment. Share this video with your spouse, your siblings, your friends at church or at the gym. Anyone over 60 who lies down tonight not knowing what you now know. A simple share could genuinely change someone's outcome. And drop a comment below. Tell me, are you a stomach sleeper? Have you noticed any of those morning symptoms we talked about? I read every single comment, and your experiences help shape future videos for this community. Take care of yourselves tonight. Sleep well and sleep wisely.